Hello, everyone. This is Professor Mo from ROFEM NCLEX Academy. Let's break down the 6 steps of the Next Generation NCLEX. The NGN clinical judgment is a 6 step thinking process, and it is important that you know how to use the steps so you can breeze through them on your exam. Let's break them down one by one. Step one, that is recognize cues. This means finding what matters. You are not looking at everything. You are going to look at a clinical situation, find relevant information versus irrelevant data. Relevant data, those are the ones that are directly related to your client outcomes or the priority of care. Irrelevant information, those are unrelated to the client outcomes. These are very, very important. You also need to know what cues are, and you want to make sure you give yourself some examples. Cues are information that you can use to make clinical judgment. Observations like signs and symptoms, or you look into their medical record and you look at their lab values or their vital signs. Then in step number two, you will analyze the cues by breaking down the connection between the information you identified and the client condition or their history. You will need to think about what the findings tell you about the patient condition at that time. In this particular step, this is what you will do. You are not writing a medical diagnosis like COPD or hypertension. What you will do is to connect the findings that you recognize with the client health condition. Then, as you move on into step number three, you will prioritize hypothesis. You will look at the data you have, then you will determine what's possibly happening in the client situation. How serious is it and why is it serious? Basically, you will identify the priority health problem. You must pay attention to the urgency of the clinical situation and the risk to the client. These two things will help you to prioritize correctly. Now, in order to generate solution, in step number four, you will need to know the expected client outcomes first. Then you plan specific actions that you need to achieve the expected outcomes. As you do this, you also want to make sure that you take note of what should be avoided in that specific situation because you are not going to carry out everything. Some things need to be avoided and some things are contraindicated. So you will need to pay attention to those. Moving on to step number five, this is where you will actually take action. When it's time to do this, you will decide which nursing actions will directly address the most important priorities of care. You will also need to remember to take note of the order in which you will implement the actions, what you will do first and what you will do second. All of these are important when you get to the point where you will take the actions. Then in step number six, you will evaluate the outcomes. This is where you ask yourself question, everything that you have done, did it help? Decide which client assessment findings you need because you need to know what you will look for in order to know if your client is improving or if they're declining. Then you will look at the client outcomes in the situation to see if the expected outcomes were met. Now let's take a look at this NGN case study. We have a 72-year-old patient admitted with pneumonia. The nurse takes note of the following assessment findings. Temperature is 102.4. Heart rate is 118. Respiratory rate is 28. Blood pressure is 88/46. WBC, that's 19,500. And lactate level is 4.2. So I want you to take note of all of these findings very closely because we are going to break them down into the levels of the steps of the NGN clinical judgment. So our question one is which findings indicate possible sepsis? Select all that apply. So when you look at all of these findings, you will see that fever is one of the answers that would definitely be correct. So our answers will be fever. Hypotension is equally correct. Elevated lactate, that's correct as well as elevated WBC. looking at the reasons why all these answer choices were correct. We are going to break that down, and we're also going to talk about why the other one is not correct. So look for relevant cues. When you get to this point, you look for cues that point to what the question is asking you. In this case, question is asking for sepsis in a patient with pneumonia. That include fever. Why is that? Fever is a sign that the body is extremely fighting an infection and the immune system is overworking. Hypotension is due to dilation of blood vessels and reduced blood flow to organs. Elevated lactate, that's really, really important because lactic acid buildup in the blood when cells don't have enough oxygen supply. Now, look at elevated WBC. Elevated WBC, that's also very correct. And you want to make sure that you pay attention to this. It's a sign of sepsis because there is a release of more white blood cells to fight the pathogen. Now, looking at bradycardia, that one is not correct. It will be tachycardia because the body is overworking. All right, let's look at question 2 on the same patient. So this is where we prioritize hypothesis, meaning that you are looking for the priority health concern. So the question is, what is the nurse's priority concern? So take a look at all the answer choices. Treatment concern and the need for education. Septic shock leading to impaired tissue perfusion. Lifestyle issues that is caused by lack of balanced diet. Electrolyte imbalance from nausea and vomiting. So, which one of them do you think has something to do with this patient as far as priority concern? Now, our answer choice, the one that has so much to do with this situation, is septic shock, leading to impaired tissue perfusion. And we need to make sure that we understand why. When you think about this step in the NGN's clinical judgment, you should always be ready and you should always make sure that you know what you are looking for. You should think about all possibilities about what is happening in that client situation. Then you decide what is most likely and most serious relevant to that situation. Having said that, sepsis causes widespread inflammation with a systemic response and it can lead to septic shock. Impaired tissue perfusion can quickly lead to cellular hypoxia, and then waste buildup is going to be really, really quick. Organ failure will be the next, and then death. In this case, circulation is failing. That is absolutely very important. So, septic shock resulting from impaired tissue perfusion is the priority concern. Let's take a look at question 3 on the same case study. So our question 3 is based on generate solutions. This is step number 3 in the NGN clinical judgment model. And over here, what you are going to do is you're going to ask yourself, what can I do? So you have a patient in your hand. You have already seen all of the assessment findings. Here now, you need to generate solution. So which of the following actions should the nurse anticipate? Select all that apply. So, what do you think about this one? Start IV fluid bolus, administer broad spectrum antibiotics, place on cardiac monitoring, administer diuretics, or you obtain blood cultures. So, which of them do you think will be correct? So, our correct answers will be to start IV fluid, of course, we are going to administer broad spectrum antibiotics. We are going to place this patient on cardiac monitoring, and we will also do blood cultures. Now, we need to break down the reasons why all of these answers are correct. Now, in generate solutions, which is step number 3 of the NGN clinical judgment, you will need to identify the expected outcomes first. Then you will plan specific actions. These are the actions you need to achieve the desired outcomes. So for this patient, once you suspect sepsis, proper treatment must begin immediately. So number 1, fluid resuscitation. That must be started to maintain blood pressure. You will also start the broad spectrum antibiotic within 1 hour after the diagnosis has been made. Cardiac monitor is very, very important, and that is needed to assess cardiac function, detect if there is any possible cardiac dysrhythmia. Looking at answer choice E, which is to obtain blood cultures, that's also very correct because we need this so that we can be very specific when it comes to identifying the bacteria. We need to identify the bacteria so that the choice of antibiotic can be smooth. All of these are important. Now, looking at answer choice D, administer diuretics. That is not correct. And the reason why this one is not correct is because the patient is hypotensive with impaired tissue perfusion. This patient does not need to get rid of any fluid. This patient actually needs more fluid. So the correct answers are A, B, C, and E. Okay, so here is our question number 4. And what we are going to do here is to take action. We are still looking at the same case study, the same patient with pneumonia. Now, we've already found all of the previous information. So now it is time for us to take action. Which order should the nurse complete first? So take a look at all of this. Place the client on cardiac monitoring, obtain blood cultures, administer the broad spectrum antibiotics, or you start IV fluid bolus. So which of them do you think will be the first thing for you to do as a nurse? The correct answer is to start IV fluid bolus. Here is the reason why. In the treatment of patient with sepsis, this is extremely very important. In the previous question, I mentioned that the client is hypotensive. That's very important. So that means fluid resuscitation is super important, and it is the first order to complete because we need to restore blood volume, correct severe fluid loss, and vasodilation. IV fluid for this patient will increase cardiac output and will allow vital organs to get oxygen supply. This is needed to prevent tissue damage and organ failure. Okay, as we are moving forward, the next thing to do is to evaluate outcome. And that is what our question number 5 is all about. So which of the following findings indicate improvement? So take a look at all these findings. Heart rate is 128 beats per minute. Respiratory rate is 32. Blood pressure is 108 over 62. Lactate level is 3.2 and the temperature is 102.4. So I want you to look at all of these choices, compare with the client findings. They are both on the same slide. This is very important. So you do a comparison and then you figure out which one of them or which of them indicates that your client is improving. Now, when you look at these answer choices, the blood pressure is improving as well as the lactate level. Those are the two answers that help you to actually confirm that everything that you have done to help this client is working. So when you look at heart rate in answer choice A, look at where we started from. We started from heart rate of 118. The heart rate right now is 128. That does not show improvement. And then respiratory rate is 32. It was 28 before. That also did not show any improvement. Now, temperature remains the same, which means that isn't improving at all. So when you are looking at expected outcomes and you look at the signs that actually confirm that everything you have done for your patient is working. So the correct answers are C and D. Thank you so much for watching and learning from this video. If you want a more NGN focused NCLEX prep, we do free NGN workshops regularly. It's live online via Zoom. Our NCLEX prep courses will improve your critical thinking, application, and clinical judgment skills. If you are a repeat test taker, I have a course that is specifically built for you. And if you need remedial course, we're approved by the Florida Board of Nursing. Don't forget to like, share, and subscribe to this channel to stay updated. If you have any questions, you can place them in the comment section. See you next time.